what about the information on starting earlier ruxolitinib? So the point of today is to have information on a patient with intermediate 1 disease treated with ruxolitinib. And we can say that we have this information. This information do not come from randomized trial, but this is a very large international study that uses ruxolitinib according to the label. And I reported now the result on 163 patients, intermediate 1 IPSS. And you can see here the result. At week 48, 81% of the patients reduced the spleen more than 25%, and 60% of the patients reduced the spleen more than 50%. This is very good. And this, I think that is very good also the rate of patients without spleen palpable at week 72. This is around 22%. So this is very unusual to obtain a complete abrogation of the spleen in patients with intermediate 2 and high-risk disease. The effect on symptoms was very clear. Here I reported the FACT lymphoma total score and the FACT fatigue score that was very well controlled with ruxolitinib in intermediate 1 patient with MF. But when you have to decide in real life if the patient is good earlier in disease evolution, personally I want to have information about safety. And so I'm very happy to say that the rate of patients with anemia was exactly halved in patients with intermediate 1 when compared to patients intermediate 2 and high. And so the rate of patients with all grade anemia was 54% in the JUMP and 96% in the COMFORT 1 and 2 in patients intermediate 2 and high. And if you look at the grade 3-4, so these are the patients in need of red blood cell transfusion, the rate is 24 compared to 46 in patient COMFORT 1 and COMFORT 2. So this is very important because we treat patients, we obtain a good reduction of the spleen and symptomatology, and the drug is safer than intermediate 2 and high-risk patient. This is a different analysis. In this analysis, we consider patient intermediate 1 according to the DIPSS, and more or less it's very similar. The number of patients is of course higher. The response rate at week 72 was large. 71% of the patients obtained more than 50% reduction of the spleen, and 82% obtained more than 25% reduction of the spleen. And the rate of spleen that became unpalpable is 30%. And again, we obtain also a very nice reduction of symptomatology in these patients. What about safety? The safety is exactly what we have demonstrated in intermediate 1 patient according to the IPSS.